Self-Injection Guide: How to Mix and Administer Meriofert and Fostemon by the Centre of Reproductive and Genetic Health. Meriofert and Fostemon are to be injected in the evening as directed. The dosage is tailor-made to your treatment plan. This will be discussed at your baseline scan and nurse appointment. A treatment schedule will also be provided with the dosage of each medication. Meriofert and Fostemon are not ready for immediate use. You must first mix the powders with the liquid included with your medication. Meriofert and Fostemon can be mixed together to save yourself from doing multiple injections. You can mix up to 6 powders of either Fostemon or Meriofert with 1 water. Please check your dose and make sure to mix with as many powders as your prescribed dose. Step 1. Wash your hands. Before we begin preparing your medication, make sure to wash your hands. Step 2. Prepare your medication. In this video, we will show you how to mix 225 units of Meriofert and 225 units of Fostemon. Each box of Meriofert and Fostemon contains 1 vial of 75 international units. The medication comes in big boxes of 10. Remove the contents from the boxes. In each box of Meriofert and Fostemon, you have a powder and a water. If you have been prescribed 225 international units of Meriofert and Fostemon, you will have 3 boxes of Meriofert and 3 boxes of Fostemon, each containing 75 international units of the medication. You will only need 1 water, so you can put the remaining ones away. You will also need a syringe, a large green needle for mixing, and a small needle. Depending on the pharmacy dispensing it, this needle might be either brown or yellow. Usually you will also get a plastic cap which goes on top of the liquid to help with opening the bottle. Lastly, you will need a sharp spin. Step 3. Mix the medication. Each powder bottle is sealed with a cap. Open the powder bottles by snapping off the caps. Take the ampoule and twirl it around if there is any medication at the top of the vial. The dot on the vial indicates the weakest point of the glass. Place your thumb across the dot and snap the top away. Alternatively, if you have been given a plastic cap, put it on top of the vial before snapping the top away from you. Once the top of the ampoule has been broken off, please dispose of it in the sharp spin to prevent injury. Open the packaging of the syringe and attach the large needle to the syringe. Remove the cap from the needle. Insert the needle into the vial and draw up all the liquid. Once done, please put the ampoule into the sharp spin. Take the first powder, insert the needle into the centre of the rubber stopper on the vial and inject all the liquid into the powder bottle. Gently roll the medication until all the powder has disappeared. Slightly turn your bottle and pull the plunger out to draw the liquid from the vial back into the syringe. Make sure that you collect all the medication from the vial. Now, put the solution into the second powder. Once fully dissolved, draw the solution back up and inject it into the next powder bottle. Repeat this until you have mixed all 3 powders of Meriofert together with the 3 Fostimon powders. As mentioned previously, your dosage will be determined by your consultant. If you have been prescribed a different dose, please make sure that you mix together the correct amount of powders. For example, if you have been prescribed 150 units of Meriofert and 150 units of Fostimon, you would only need to mix 2 powders of Meriofert together with 2 powders of Fostimon. Once complete, remove the large needle from the syringe and dispose of it in the sharps bin. Remove any air by holding the syringe pointing upwards and slowly pushing the plunger. Attach either the smaller brown or yellow needle onto the syringe and take the cap off. If there are any bubbles in the syringe, you can give it a small tap. Expel any air by holding the syringe pointing upwards and pushing the plunger slowly until all air bubbles are gone. When you see a small dot at the top of the needle, it is ready for injection. Step 4. Inject the medication. Meriofert and Fostimon are injected into the subcutaneous tissue anywhere below the belly button. Hold the syringe in one hand and with your free hand, gently pinch your skin around the injection site. Insert the needle into the tissue at a 90 degrees angle. The needle goes fully into the fat tissue. Inject the medication by slowly pushing the plunger until all medication is administered. Wait about 10 seconds before you remove the syringe. Take the needle out and dispose of it in the sharps bin. Please also dispose of the empty powder bottles in the sharps bin. For questions and further guidance, please contact the nurses on 020 7837 2905.